lay down on the bed, feel your own. Try to feel some other people's that you know, okay, that'll let you. So you can start getting in that idea of where is this pulse gonna be. For me, it's usually about middle of the leg, but you have some people who have a tiny little bone structure with a lot of adipose tissue added on. So those kind of people, it may be closer to the pubic area and they still got a lot of excess over here. So it's not right in the middle where you think. Sometimes there's like extra creases and you can't quite tell, is this the bend of the leg or not? Sometimes we actually have to push stomachs up out of the way. We actually have to put some tape and tape their stomach out of the way, all right, to be able to actually get to that perfect spot where we want to stick, which is right at a little above, a little below the inguinal crease right here in the leg, okay? So feel for the pulse, all right? Got a good pulse? That is where I need to visualize, that's where the doctor's gonna stick. So when you read these notes later on, it says that we want to prepare, and so with shaving and with cleaning, about 2 inches on all sides from where that pulse is gonna be. So yes, we may shave actually up onto their testicles if it's a male, almost midline, you know, shave the pubic hair away, okay? If we're radial, so right around here is where the doctor's gonna access, anywhere from about, they don't usually like to go exactly in the bend, they go just a little bit above, and if you feel on yourself, you can feel your pulse right there, okay? And so about right in that area. So we can't completely go, we don't usually go 2 inches completely, but with that drape, the fenestration, if you remember seeing that picture for the radial, is about that big around. The fenestration for femorals is about that big around. And again, that's why we need to make sure we have a large space. Let's see, probably, actually I can show you on this drape, again, what I'm talking about with fenestration. So the hole that we're actually gonna have access. And so the ones for the arm are smaller. Drapes are old. Let's see it through here, but you can see that that is a smaller hole. So we don't have to go quite as far, but even with me, I have hair right in this area, so you would still need to shave that hair off there, okay? If there's no hair, then you don't need to shave if it's radial, okay? All right, with shaving, again, we wanna make sure, some people may come to you shaved, they may do it in the holding area. Some people, you're gonna have to shave right there. Some people, they said they shaved in the holding area and they shaved about that much. So you have to reshave. Some patients who have had cats before and know that they need to be shaved will try to shave for you. They usually never shave. Everything needs to be shaved. You're gonna have some people who don't even have any hair hardly there, and then you're gonna have some that have a lot of hair. All right, so you're gonna use your clippers, you're going to shave with the hair, try to get all the hair up, get it, throw it in the garbage. We usually use some tape, kind of like a lint brush. You ever use a lint roller? We'll take this stuff called silk tape and we'll just kind of try to get all the little pieces of hair. Don't blow on it. You got a mask on anyway. But just, you know, we wanna try to make sure that all the hair is gone as much as possible, okay? Now, we're set, no matter what it is. It could be that they told us to prep both groins and the radial. Whatever they do, it doesn't matter. So now I've got in there talking about the different kinds of cleaning. I've got really 2 systems here. This I don't think you're gonna see. You may see a system more like this with doing pacemakers and stuff, but most labs are gonna use just a cleaning stick, okay? I do have on there, there's an iodine cleaning stick, which is DuraPrep, and then there's the chlorhexidine cleaning stick, which is called a ChloraPrep, okay? A little different technique with those. We're gonna say that this is my iodine-based, my DuraPrep. When you clean with it, you start in the center where you think the doctor's gonna make the stick, and then you circular, let me get this out of the way now. Just trying to give you an idea of maybe, because you can't see the inguinal crease on him. Start where you think the doctor's gonna make the stick, where you felt the pulse, and I do have something else to say about feeling the pulse in just a minute. Circular motion. Don't go back over the same spot. That 2 inches, okay? Throw that in the garbage, all right? Now, totally different for the ChloraPrep, right? ChloraPrep is going to be cleaning and scrubbing over and over and over the site, 2 inches everywhere, and actually I can demonstrate because these are pretty much clear. I can really do it kind of with him for 2 minutes. It's supposed to be. That's the longest 2 minutes ever. Some people don't do it for the full 2 minutes. You're gonna see that. You wanna try to do it as long as you can. You know, some of your preceptors may be like, okay, that's good, that's good. And you're like at a minute, you're like, but honestly, I've done that myself, and it's very potent, and there's very, very few infections in the cath lab, I will just say that. But according to manufacturer specifications, it is supposed to be done for 2 minutes. Now, if you're doing a pacemaker or an any kind of implant, they are very strict on that. They want you to do like a 5-minute scrub. All right, can be done 2 ways. When I'm saying that, it means, what I'm meaning is it can be done by the circulator. Right now I'm not scrubbed in, I'm the circulator. So did you see how I just took it out? I did not touch the sponge, okay? That's the big thing. If you're doing it as a circulator, you don't touch the sponge, right? It's a lot like the glow sticks and the glow bracelets. You're gonna pop. This one's not tinted. You're gonna let, you can see that it's gotten wet. Let it get on that sponge good. And then we're gonna start our cleaning. This one is not tinted, so, but back and forth, and just, this is like in my way. Let's put that up a little bit. 2 minutes, clean, 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 clean. If it was the radial, we would be cleaning up into the hand, okay? So I'm gonna clean and up onto the arm. Far up towards the back as I can get. Cleaning. And I'm just gonna tell you that most people do use a separate one from groin to arm. The company says that you can use the same one, but most people, we just decide, because we've already touched and it was dirty, even though this stuff is so potent, they say that it, you know, kills well. I think you're gonna see most places, if they do groin, they would use 3 separate ones for them, okay? Now, this could have been passed off onto the sterile tray. All right, so this was the other way I was talking about it could be used. And once I'm scrubbed in, then as the scrub tech, I come and I crack it. I could touch any of it at that point. And then I come and I wash. The big issue there is you can't touch the patient before you wash it. So if, are you okay?
I feel lightheaded.
Okay, sit down.
Sit down.